Hello, my name is Hallie Steadman, and for this project, we conducted a review of both academic literature and popular media on the self-removal of the IUD. Since we are virtual, I have broken up this poster into a few different parts so that way it's easier to see the information that is being presented. So let's hop right on in. So for our background, the IUD is a highly effective form of contraception with a 99% effectiveness. It's considered by some to be the gold standard in contraception. Barriers to this form of contraception may include costs associated with in-office appointments for both insertion and removal of the device. Although IUD removal is generally simple and straightforward, it has been compared to being like removing a tampon. And IUD self-removal may help some patients to overcome barriers to removal, like cost. And IUD self-removal may also foster the retention of reproductive autonomy. For our objective, we wanted to better understand the current information regarding self-removal, as well as provider and patient perspectives on the topic. To do this, we conducted a review of academic literature versus provider perspectives and patient experiences in popular media. Our methods followed the typical literature review methods. For our databases, we used PubMed, ScienceDirect, and USearch, which is through the University of Utah. Queries that we used included self-removal of IUD, IUD self-removal, and safety of IUD self-removal. Sources included clinical studies, inventories of provider and patient perspectives, and other literature reviews on this topic. These search results were then categorized into groups such as perspectives on self-removal and patient experiences with self-removal. And then we move into our popular media. Now you may be wondering, what is popular media? And we decided that these sources that are popular media have not been reviewed or published in academic literature. They may include websites that are like health type magazines like Healthline, and also other popular websites like Cosmopolitan, as well as YouTube videos. The search engines that we used were Google and YouTube, and queries included IUD self-removal and can I remove my own IUD? Categories of search results were also made and grouped. So we grouped all our sources similarly to our academic literature. IUD removal training videos on YouTube were also included since they are readily accessible on YouTube for anyone to find. And then we compared our two results for similarities and contradictions, and we'll discuss that in our results. So for academic literature, sources say that in-office removal is a barrier to IUD use, since wait times can range from 2 to 14 days with a 10-day average, and appointments can cost between $50 and $1,000 with an average of $262. Surveyed providers acknowledge that IUD self-removal is generally safe, but also some admit to withholding information about self-removal to avoid patients making the decision to remove their device without consultation. This action jeopardizes patient reproductive autonomy. Presenting the option of self-removal of the IUD has been shown to increase interest in and improve attitudes about the IUD. Self-removal is highly dependent on string length of the IUD. I believe that the length is around 5 to 6 centimeters for a successful attempt, and self-removal generally occurs with few complications. Popular media has a different perspective on self-removal. It depicts self-removal as a last resort method. Providers are divided in their opinions about the safety. Some acknowledge that there's no pressing danger, although they may still recommend an in-office removal. Others describe concerns about patients not recognizing certain complications that would prompt an in-office removal. Or prompt provider intervention. Providers express concerns about patient lack of knowledge of reproductive autonomy, anatomy, and the structure of the IUD. So not being able to recognize that the IUD is intact upon removal. Those who remove their own IUDs, however, depict the experience as easy, painless, and more accessible than an in-office removal. Common reasons for self-removal include lack of insurance coverage and provider refusal to remove the device. When we compare these two media forms, we see that the academic literature expresses opinions such as defense and provider coercion, successful related to string length. It's a viable option for removal that may improve perspectives of the IUD and few complications occur. Whereas in the popular media, we see IUD self-removal expressed as a last resort in removal. There's a want from patients who have removed their own IUD for centralized instructions on how to remove it. There's no real pressing danger, and patients just may lack a knowledge of reproductive anatomy, which may prevent them in recognizing certain complications. However, while these two opinions are a little different, they do share some similarities. Both the academic literature and popular media depict positive patient experiences with self-removal. They both agree that self-removal may be a good way to defend reproductive autonomy, and it also reduces barriers to IUD use. In conclusion, where do we go from here? We suggest that globally accessible information on IUD self-removal should be created. This can provide information on reproductive anatomy, IUD structure, removal techniques, and instances in which a patient should see their provider for removal. This information would serve to address provider concerns on safety and patient education, educate patients on how to safely remove their device, and retain and restore patient reproductive autonomy. Again, here is our poster in its full, and I would like to thank you all for listening in.